It's really hot in here.
I know. Will somebody go tell the lady at that desk? Because
She's gonna tell you, we're caught up here.
I know she's on something. Let me go see.
Some of it, you're pregnant.
I'm not gonna sit in here and sweat, especially if we're not watching that movie.
Alright, so this is just a review, kind of what you need to know for tomorrow too. Flaccid, the term. What is the definition of flaccid? Flabby, soft, weak. That's what happens to most muscles, like in stroke patients when they've had a stroke and it's affected that certain side. Those muscles, that's how we describe it as flaccid. They're not using it. The nerves have cut off to that muscle, so there's no message being sent to tell it to move. So it becomes flaccid, flabby, weak, and soft. Alright? And then the opposite of that would be hyperreflexive, meaning there's too much reflex. It's an excessive response. That would be something like in a seizure activity. You know how they get really tense and stiff. There's too many signals being sent to that muscle, so it's extremely responsive. This is just review of the terms. Dysphagia, what does that mean?
Difficulty swallowing.
Thank you. Yes. They have trouble swallowing. That could be like they have some kind of obstruction, maybe a mass, or their thyroid's enlarged, some kind of throat cancer. They might have nerve damage after they've had a stroke. And so it's affecting those muscles that help us swallow. So we're going to go into that further later when we talk about strokes, but just so you know that term. Contractures, what is that? That's when the muscles and the joints have become fixed and they're in that flex position, and then they're pretty much useless after that, right? They're not going to bend. Okay. Agnosia. Remember that one? That's going to be on your mapping tomorrow.
Can you spell it?
Agnosia. It's like considered total or partial loss of the ability to recognize familiar objects. Remember we talked, you'd say, hand me that thing that you drink from. They can't say the word cup. They can't remember it. And that happens like with organic brain damage, like Alzheimer's or some Parkinson's, where they're starting to lose some cognitive ability. So, agnosia. And then hemiplegia. Can you remember that term? The paralysis of one side. Paralysis of one side of the body. Now I've got y'all handouts on that so you can kind of get a visual of it too. It could be the right or the left side of the body, hemiplegia. And when you're having a stroke, it's going to be the affected upper extremity is the one that's like, once you've had this stroke, that's the side that's affected, it's going to pull inward. So that's how you can tell them. I mean, obviously they're not having movement, but automatically it's going to pull them on that affected side. And the same with the leg and the foot will drop on that side. Okay. And then seizures, real quick. What do we do first thing? Turn them on their, ease them to the floor. Turn them on their side though. Protect that airway. Protect the head. Airway and injury are the first things that you want to look for on a seizure patient. Make sure that you've got something soft under their head. You never leave them alone. Stay with them. Try to time it. Make sure you know how long it lasted. And then this is something you really need to listen to and pay attention on for tomorrow. Expect the postictal phase. What are they doing in the postictal phase? Sleeping. Are you going to reorient them during that time? No, because they're still asleep. So be real careful the way that's worded. If they're postictal, that's what you expect, and they're going to be sleeping. During that time, what are you doing though? Respirations. Yes, you're monitoring the respirations. Very good. And then we're going to reorient them after they come out of it, after they're awake, okay? So make sure you pay real close attention to that. For those of you that want like a good form review, all of the meds procedures are on page 1922. So if you're doing flashcards or whatever to get ready for your NCLEX, you just make flashcards and that way you know those are procedures. Okay? Alright. she say about our air conditioner? She said, fine. That was my review.
I'm serious. Support me like I support you. Can I show you my TV?
And she's gone to lunch, so that's irritating. Okay, so this is still.
Do we know what air conditioner is? We don't need no.
I just turned it down. It was turned off. And she lives for really 75.
She gonna come here and say, you go.
Well, I turned it down to 65, so she can knock her icicles off. Okay, multiple sclerosis. That's MS. Anybody have any patient with MS or know anybody with MS?
Yeah.
It's pretty bad. It's sad. It's sad to watch, and because they're cognitively still just fine, but their body is deteriorating right in front of them. And especially for someone who's young and healthy, this usually happens in younger people, so they're used to being independent, and now all of a sudden they can't brush their own teeth, can't brush their own hair, they can't take care of their kids. Yeah, it's bad. It's a chronic progressive thing, degenerative, meaning it's just going to get worse, and it's a neurological disease. It's where they really don't know the cause, but the T cells, y'all remember the term T cells, like for HIV patients, AIDS, it goes together in your head. T cells are like your body's first soldiers. They go in and attack all of the things that are trying to attack your body. And so in MS, something goes wrong with them, and they don't understand what's happening, and they end up attacking your own body. Your own body, your own T cells are attacking itself. I turned it down to 6.5. It was turned off.
Oh yeah, I had escalated, so.
Okay.
Just left Michelle's office, I will not get this.
Tell her you're,
Yeah. Do you know how much tolerance I have for 7
yeah, she's out to lunch. She turned it off.
She's not.
Well, it's on.
Are you talking about the other lady?
Yeah.
I'm gonna get us a key on there.
Oh, I got one. I went in there. If I didn't know she was gone, I would have just.
Sweat another sweat.
I'm tired of it. Me too. I mean, I go home stinking like a homeless person. It's been at the bus stop. I'm tired of it. I stink. Okay. I mean, it's bad. Okay, because it's everywhere. They're every room is hot. Okay, so T cells are attacking your body, and that's what's happening. You are that myelin sheath. Remember when we did the neuro, and I showed you the little white waxy protective covering? That is what's deteriorating. That is what helps that nerve impulse travel faster to the muscle to tell the muscle what to do. Well, in MS, that myelin sheath has just deteriorated, and now the nerve impulse isn't getting to the muscles, and that's why they can't use their muscles. What happens to a muscle that we don't use? Just look at the back of my arm, and you can tell. What is it? Flabby. It is atrophies. So that's what happens in these little MS patients. They become very deteriorated and atrophy. Okay? Now, where's he going to go? Is he going to go turn the air down too? What's happening?
No, he's taking calls right now from the.
From the nurses at the hospital?
Yes.
It's all right. Don't get us started. So there's your slide on that. And like I said, these are all, your PowerPoints are all on your grade book, okay? The symptoms are real vague. These start out, these are young people. They're like 15 years old. Like Ashley said, there's some as young as 4. I had a student at my last job that was having MS, a real rare form of
Lucy
it.
said MS.
And so they start out just real vague, and that usually doesn't get diagnosed. There is no really test, like a lab test or X-ray. It just happens. They find out that they're starting to see problems, and they put it all together when they get to the doctor's office eventually. Alright, y'all. We need to get through some of this or we're going to have a hard day tomorrow. No treatment for it. They just have to do a lot of nursing measures, okay? They'll have visual disturbances, like suddenly their eyes aren't working right. Why do you think that is? What, Jay? Oh, yeah, sorry. It's this projector, isn't as wide. Is that any better? Any? It's her varicella vaccine is attacking her eyesight now. Alright, milking it. So they'll have visual disturbances because the nerves aren't telling the muscles what to do. Urinary tract infections, why do you think that is?
Because they're not controlling.
They're not able to control the muscles to empty the bladder, and so everything just kind of builds up on them. They all have, if it's a male, they can have sexual impotence because there's no nerve telling that muscle to work. Swallowing difficulties, bowel and bladder, they get constipated, again, because the nerves aren't working, okay? So when you think MS, don't just think muscle, think the nerve, the myelin sheath on that nerve has deteriorated, and that's why the muscle isn't working, okay? So then you start thinking about all kind of muscles. Swallowing, don't we use muscles for swallowing?
Yes.
So what are we at high risk for if we can't swallow? What if our bowels aren't working? Don't we have muscle in our bowel? If our bowel doesn't work, what are we at risk for? There you go. Okay? We're not emptying your bladder. High risk for UTI. That's how you got to start thinking for those kind of questions, okay? Ataxia is the impaired ability to coordinate movement or tremors. You may see that term. Okay. And then nystagmus. Y'all remember that one? What was that? Nystatin. Similar. One's a medicine, one's an eye disorder. They jump, right? That's when you see people that have jumpy eyes that almost looks like, have you ever seen an albino?
Yes, they go like this.
Yes, their eyes. That's nystagmus. Can you do that again?
Don't talk about
Not
it.
making fun of it, but just saying that's a, and you'll see that like a lot of, people that have that problem with it because the muscles are not being able to be controlled. Okay? So nystagmus is an infestation. Ataxia is the impaired ability to coordinate that movement, and so they'll have tremors. They're not really in control of their muscles. Like I said, there's no testing. It's just based on your history and physical and kind of the signs and symptoms. Sometimes they'll do a CSF, the spinal tap, and check that spinal fluid to see if there's increased lymphocytes and monocytes. What is a lymphocyte and monocyte? What kind of cell?
White blood cell.
White blood cells. So why are they checking for white blood cells?
Elevated infection.
Because remember, what did I say at the very beginning? What's attacking us? Our T cells. And our T cells are white blood cells. See how all that works together? Okay. Sometimes they'll give ACTH. That's the adrenocorticotropic hormone. This is all in your book. When you go through, you can just kind of highlight them. Or steroids, just mainly to help with getting through the day. It doesn't cure it, okay? They might give antibiotics, like just for prophylactic because we're, having UTIs. Maybe some antispasmodics, some stool softeners, things like that. Increased fluids, high fiber diet, protein diet, stuff like that. What are you doing if you're not moving around? What's going to happen to your skin?
Right down.
So what's that? What are we worried on that for then? We need to make sure that we're rotating our patients. Yes. PT, but not to the point of exhaustion because they're going to be tired because their muscles aren't working well. So we don't want to overwork them. So they need rest. And this is another big thing that you need to know for NCLEX on MS. The myelin sheath is deteriorated, right? That's why the muscle isn't working. They might have nystagmus, and they need cool, quiet climates. They cannot tolerate heat. So any of your little patients, they need the room cool, extremely cool. Turn the air down. They don't need to go outside during the heat of the day. They need to stay either inside all the time in the AC or early morning or late night. They don't need to go out when it's hot. It just flares them up. So that might be one of those, where they say, well, be a good teacher. Okay? They're going to have slow speech and slow to respond, again, because it's a neuro thing, right? It's dial-up. It's not high speed. It's real slow. And the other thing is they'll have like a weird, this is a real weird thing with MS, and they don't really know why, but they'll have like sudden emotional outbursts. They start laughing inappropriately or crying, or then get, just real inappropriate emotionally. Just bursts out of nowhere. So I don't know why, but if that happens, it's real upsetting to them and their family members, so be real supportive, okay? Any questions on MS?
You said, sorry.
In that 5 minutes that I went
She
through.
got MS.
They laugh or cry inappropriate.
Yeah, they'll have like an outburst.
Do this once and then see all her
I don't think that was funny at all. Did not laugh.
It's just real, it may come up as she's having an emotional outburst at an inappropriate time. That may be the way they word it.
I had a patient that had that, and I was changing her. She just started crying, and I was like, "Are you okay?" And she's like, "Yes, I just."
Yeah, they get real emotional.
Oh God.
Whatever. Who said that? Okay, Parkinson's disease is really sad too. Have y'all had patients with this? Yeah. This runs in my family, and I've seen a lot of family members with it, and it's sad because I know that's what's going to happen to me. It's sad. It is another chronic deteriorating thing.
I think it's kind of cute. Like, it's so sad, but I mean, you see the older people, I don't know, I just
They're sweet. They're very vulnerable. They're very vulnerable. They do. They have okay. They have this usually starts around 50 years or older. It peaks in the 60s. So this is going to be your older. I would say old 50s old because I'm 44, but you're getting on up there when you start noticing little symptoms. Doesn't sound old to me anymore.
Was Michael J. Fox?
I think he has. Yeah, but he was a lot younger.
Isn't he alive?
Yeah. It's just where everything starts slowing down. It's like kind of the same thing. It's a neuro thing. They're not getting messages to the muscles. They get rigid muscle tone. That's why they walk with what Schneider's in a shuffle. That's called the Parkinson's shuffle. They just take little tiny baby steps, and you'll see them, and it's like, oh my gosh, I have to ambulate with that patient, and it's going to take me an hour. But that's how they walk. They cannot make larger steps. The brain is deteriorating, and that's called when they can't. Everything slows down, and the initiation and execution of the movement. That's bradykinesia. Brady means slow. Kinesia means movement. So if you see slow movement, think
That was on
our conversation.
The
Did y'all get it right?
no.
Aww.
We wouldn't have this
She's
first.
They get real rigid, and they have the tremor, the shake, the Parkinson's shake. Has anybody ever seen a patient with it? They'll see them, they just can't control it. And sometimes they'll have weights. They give them weights to hold on to help, because they're still cognitively aware, but they can't control that tremor, so they'll put weights on them to try to help lessen that. Or you'll see them in the cafeteria trying to feed themselves, and their peas are falling off their spoon. It's heartbreaking. And they have these things, OT, you're asking about OT, a weighted spoon or fork, and it helps to control it better, because it keeps it from shaking as much. So, yeah, it is sad.
And everything's so cute.
I know. The other thing they have, there's a really good picture of this on page 1927. It's usually more common in males, but women do have it. I've had a couple of relatives that ended up with it, and there's lots of patients that are female with it. They get that kind of that posture, they're slumping over, and then that's the shuffle and the tremor. And then they also have the pill rolling. Y'all ever seen that or on a test or seen a patient do it? It starts out, it's called a pill rolling, because it looks like they're rolling a pill or a coin. And it just starts like this.
I always have to do this. Is that what that is?
Is it the early signs?
Maybe.
Yep.
But they'll do a little pill, you'll see them, and it's involuntary. It's like when they're busy or distracted, they'll have a little pill rolling movement. And then you ask them something and they stop, and it stops, because they're concentrating on what you just asked them or a task to do. But then when their brain goes back on autopilot, they start that pill rolling thing. It's just a repetitive movement of their fingers, of thumb and forefinger. There's kind of some things that it can be caused by, that they think they're kind of still doing a lot of research. It can be drug induced, like they've taken something and it damaged that part of the brain. be. There's a lot of links with it. Post-encephalitis, like if they've had encephalitis, these symptoms start showing up. But a lot of it, especially in the older people, it's the plaque, the arteriosclerosis. It's just clogged up and they're not getting blood flow to that part of the brain, and that brain part of the brain is wonderful. Very rare in African Americans.
Finally, we get to rare
No,
animals.
y'all have hypertension and diabetes, but not
So we eat
Parkinson's.
a lot of kids.
Yes.
A lot of kids.
They think they kind of linked it with the damage or the loss of the dopamine producing cells. So that's why we give them what? Anybody know? L-dopa. That's a short for dopamine is one of those neurotransmitters. Remember when I showed y'all the string with the neuron, the chain of neurons, and you get to the right before it touches the muscle, there's a gap, the neuromuscular junction, and swimming around in that junction are neurotransmitters or chemicals. Dopamine's one of them. It helps transfer all that those neural signals to the body. And if you don't have enough dopamine, that's why you see these symptoms. So dopamine is loss of dopamine or low dopamine levels is what they know is a telltale sign of Parkinson's. They think it's, like I said, genetic, but there's no known cure. It's more common in men, rare in African Americans. Also, low estrogen levels can trigger this, they think. So they will give them dopamine, and it's levodopa, L-E-V-O-D-O-P-A. That's the drug, the trade name for it. So if you do in flashcards, levodopa, L-dopa, for Dopar. That's what you give them for Parkinson's. You need to know that one for sure, because it's very common and it's been around forever. And they might ask you that one. L-dopa or Dopar is another name for it. That's for Parkinson's. Simitrel, that's another drug they use for Parkinson's. Simitrel. And they can sometimes start doing this deep brain stimulation. You know, kind of like when we talked about the seizures, they go in and change the electrical currents in the brain. They can do that with Parkinson's. They put electrodes on them and literally try to shock them, and it's helped a little. Another thing that they're tinkering around with is stem cell replacement. Have y'all heard about stem cell in any way? You know what that is? They're like the cells that really aren't assigned to anything yet. They're like blank cells. So because they're from the brain stem of a unborn baby, and they haven't been assigned because they're not mature yet. So they take them out, they harvest them, and they can put them anywhere in the body. And the body says, "Oh, I need that. I'm going to make that a muscle cell, or I'm going to make that a brain cell, whatever." And that new stem cell turns into whatever. And they're having a lot of success with curing things. They can even make a pancreas cell. So then that cures diabetes, right? If we can make a new pancreas. They're having a lot of success with stem cell research. You know, it's kind of controversial, but scientifically, that cell knows what to do, and it becomes whatever we need it to become, and that could cure a lot of things. So, oh my God, can you smell me yet? I'm just stinking.
Yeah.
I'm not kidding. I'm sweating down my back. Okay, so nursing measures. We know this is somebody that has trouble walking. What should our first thing be? Our high risk of falls. Right. High risk of falls. They can't swallow good, so aspiration risk, things like that. Medicines, you know, we want to make sure they're taking their meds, because this is just a chronic thing that's not going to get better, but they can control some of the symptoms with the L-dopa. You want to make sure they're chewing their food really good, because remember they have that little twitch, and so they may not be able to. There's something flashing out there. Did y'all just see that? Oh, I was like, somebody's shooting. We're all heading out.
Okay,
We're gone. Anyway, make sure they eat 6 small meals instead of 3 large. That way they don't get tired chewing so much. Okay. And then high fiber diet. High fiber, yeah, increased fluids, things like that. All of your little elderly, that never hurts. Have a high fiber diet. this was on your syllabus.
That was on our
It-
test.
It's not on your syllabus. We'll just read through it. Autoimmune disease of the neuromuscular junction. Same thing we were just talking about. There's something that's not allowing those muscles to move. The nerve is not connecting to the muscle. The signal's not going there. Not working. Okay? Antibodies are attacking the acetylcholine, which is another neurotransmitter, and the muscle isn't working. What was the question that y'all had on that?
It was on there.
Did you get it right? What'd you say?
When you put about this side?
What equipment you would have on that
It's like, yeah.
That was the answer.
This might have been what we
answer?
needed to take after.
Suction machine.
Because they're hot or aspirate. Yeah, Sam gets 77.5.
On the nervous,
Oh, I don't know. What do you
Yeah,
want?
you got 77 on that one too, didn't you?
He needs to be your study buddy, see?
You don't want to be our study buddies. Study buddies, and he can't do that.
Aww. Was this on your test? Was any of that on there?
That was on the test.
Lou Gehrig's disease?
Yes. See, this is
That was
it.
on there too. So all this was on your, I have all your PowerPoints from here on, y'all, they're on your
I'm wondering if
grade book.
we should have done this.
Well,
Is
we
it
know
all
that's
on
what it
there?
is.
All on there now?
Well, then it's no, we just supposed to read it.
Yeah, and then
So, but these have been on your grade book. I have used these PowerPoints. This is ALS, Lou Gehrig's disease, in case you come across that again on NCLEX. It's not on your syllabus, so there won't be a test question here on it, but just know it's another thing where that muscle and nerve are not working together. Motor neurons, remember it's supposed to be motor neurons. Remember we talked about that when I did the little string thing? Sensories are coming in, and motor neurons are the ones that are sending it out, telling your muscle to move. Why do you think they die so quickly with this?
Do what?
They get it and then they're dead within 2 years. Why do you think? What part's paralyzed? They can't breathe. The diaphragm's paralyzed, becomes paralyzed, and they're not breathing in or out, and then they literally suffocate. So we just try to keep them as comfortable. That's not going to be on your test for in here, but that's just good
just a
review.
besides our next test, that was the last. Do we have any more ATI tests? Oh, great.
I mean, there's two.
Research file.
Passing around the Parkinson's thing, a handout. They have, they call it a mask. That's why he has a mask on. It's like a blank expression because those neurons are not going to their facial muscles, so that's why they just have that blank look.
It's kind of funny though, when you're trying to talk to them and they're looking at you.
Yeah, they're blank and they're looking at you like they're throwing shade in your room. You don't know. So you just have to remember that that's part of the disease for Parkinson's. It's a telltale sign, that mask expression. And it's got the pill rolling thing on here, the hand tremor, all of that stuff that you need to know for your NCLEX, okay?
And then we need to know for our ATI test.
we should take it tomorrow.
For real?
Redo it.
Already done.
Shuffling gaits on here, the stick posture, everything. Brady Kaninga. So just keep this in your little NCLEX book, okay? That'll be real helpful because Parkinson's, that's very common and they like to put that one on NCLEX. And you might want to put, what's the treatment? What's the med they take? Okay.
But they don't just ask you what's the medicine they want. They're like, what's contraindicated to levodopa, and then they give you 5 questions you've never even heard of.
That's true.
Know it. It's awful.
Yeah, that is true. You're like, first of all, it's taking back a step. What the hell is that?
Number one. No, they're awful. Just say a little prayer before you go in. I'm telling you, that's all you can do. Just study and do your best, and then extras. And then just hope that they don't get it. Was stroke on there this morning too?
Yeah.
Cerebrovascular accident. CVA. The brain has been attacked either by a clot or a bleed. It could be either or. Now, what happens if you're having a stroke that you're bleeding inside your brain? What does that do to your intracranial pressure? Increase it. Because now you've got all this extra fluid spilling out and it's squishing your brain. So, I got you a little handout coming around for a stroke. Don't laugh at this lady's picture. She looks pitiful. No, I didn't draw these. They're out of the book.
I picked the one that said,
What they're having, it's a brain accident. It's a brain attack. That's what it says. They're going to have a bad headache, mental changes, confusion, disorientation.
So the question is, like, if they get the medicine, and I guess it's their first time, what do you expect after an hour? And it was migraine headache.
The first time to have a stroke?
No. Well, yeah, I think it was the CVA. They got some type of medicine. Their first time. What do you expect to find an hour after that?
Right. Yeah.
And it said it was a headache.
So the clot buster is probably what they're giving them, and something because in a stroke, the main reason, the most common reason for having a stroke is the blood pressure is too high. So you want to what? Bring it down. So what happens when you vasodilate somebody too much? They get a severe frontal headache.
we can read access to computers. I think
Well, maybe that's explain this question.
Right.
So would she, I mean, will they know that? Can they see that from your picture? But that's the grade you get when we take this one, or did it change it? Points? And you can take it again. Because then it would make, the rationale would make more sense.
I messaged her and asked for my total points, and she sent me my total points.
Yeah, I would just contact her. I'd call her and let the message in.
And that's 130 points.
So did everybody get the stroke sign out? Are you getting this Donna one too? Oh, I got a couple. So, well, hey, Sequoia. How you doing? Good. So when they're having a stroke, I don't need to stroke. Mental changes, they'll come in, they're real confused, disoriented, memory impairment, they may not can talk to you, they have what's called garbled speech, because they're trying to talk, but it's very incoherent. It sounds like a baby babbling, because that part of the brain that's responsible for language is stroking out right now, and so it's not working, right? If they're having, they'll do a CT first to make sure that there's not a bleed, because the treatment for a stroke, if it is a clot, we're going to give a very strong clot buster. If they're already having a hemorrhage, which means a brain bleed, do we want to give them something that's going to thin their blood even more? No. So that's why they'll check to see if they'll do a CT first to see if it's bleeding or not. If there's no blood, then they know, okay, then we need to, it's a clot, and we need to give them a clot buster.
These were on the first.
Aphasia.
Well, which side of the brain?
We said that last week. Did you get that one right?
No.
Why did you get that? Remember? I said the hemisphere, they're crossed. Remember? So when the stroke's on this side, it affects the opposite side of the body.
We didn't have that option.
What, didn't have that option?
No, the options were because it affects whatever something, another one was because it affects something. The right answer was that they have speech problems.
Yeah.
That was
So, like, it was
I need to take these.
left.
You
and
do.
we didn't have
You
the-
should take it with me.
group.
Can you fix that?
We'll let you make the final decision.
We should take the predictor together.
We should. that's why she's frowning in this picture, okay? Incontinence, because that sometimes they have, sometimes they don't, because that part of the brain that controls that nerve to the bladder and all is not working. They may have seizures just because of the brain damage, and certainly we do the same protocols for anybody with a seizure. You keep them on their side, follow precautions, all that. They're going to be, emotional lability means they're real, like your little lady, outbursts. Any kind of neuron, when you mess with the neuro, you're messing with a personality. So they'll have all these weird emotional outbursts. Inappropriate. They're not weird. They're inappropriate. Like you just told them something really sad, and they start laughing. That's inappropriate, right? Horner syndrome. Have y'all ever heard of that?
What?
It's on this sheet.
No.
It's changing their eyes.
Oh, Horner. No.
Horner.
Oh yeah, it's like one of the other deals we do. Like tuberculosis, did you know tuberculosis medications make you where you can't see red and yellow?
Yeah, we didn't know that either. Huh.
I didn't know
When
that.
did y'all learn that? Wait.
We took a test the other day and it was on one of the
ACI test.
Was it not required to all of us?
No, it's just
Well, that's what we're on. So just know, with the stroke, we're going to watch them for aspiration. We're going to watch the blood pressure. Like I said, it could be ischemia from a clot, a thrombus, or an embolus, or it could be a hemorrhagic, meaning it's bleeding. Either those are two different kinds of strokes. They're both very dangerous, but we don't want them bleeding.
That's what you're gonna sign for that. She's having one of those
Inappropriate outbursts.
She is.
So here's your assessment. They come in. This was your ATO this morning. Headache, numbness, one-sided weakness. Anything that's one-sided, we know that's going to be neuro, right? This R3L, what's that term we just said this morning? Can't name an object, right? What's it? I'm confused. I'm having a brain aneurysm. I'm sorry. In a minute we will. Aphasia, sorry. I told y'all wrong. Difficulty speaking and swallowing. We're not being real productive today. CT, that's going to be your first thing because you got to rule out if it's a bleed or not. And then an MRI. And EEG, which one is that? Electrodes on the head. And what's our thing for that? Wash your hands. And this is what mine looks like if I don't even wash it in 2 days.
Oh God, and you're breathing.
And I know, I'm a funky monkey today. I'm gross. Okay, PET scan, and carotid Doppler duplex. Y'all know what the carotids are? We go through and it's like an ultrasound to see if there's blockage going to the brain. We've got a huge big blockage right here in our main carotid artery, and the brain's not getting anywhere.
Don't they go into the side?
They can, but the carotid is like they can do a Doppler. It's like an ultrasound.
Because I see that the hospital they did.
That's at half. They can do, but this one is, we're just going to do it outside. It's quick and it's not invasive. And because with those, when you have what you're talking about, you have to hold pressure for a long time or they'll bleed out. This, we know we're going to have to be doing something with them. We don't have time to stand there. So they'll do the carotid because it's just external. It's not invasive. And it just is like an ultrasound on a baby. Just like you see your baby, you can see there's a clot in their neck.
Oh shit. Same thing. This what? This R3 is what?
Oh yeah, yeah, like staying in the object, right?
That's something else.
Okay. Keep me straight, Sam. Sam, just get up here. All right, so TPA, that's your big pot buster. Was that what they gave them this morning in the question? They gave them the TPA. That's the same thing they'll give to for if it's a non-hemorrhagic stroke or a heart attack that they're having clot in. It's a real strong blood thinner. Okay. DT and OT and speech. I know. We're almost done. Nursing, ADLs, y'all kind of know all that. need and they're safe. You may have to assist them with communication because they're going to get frustrated. They want to tell you everything and they can't, and everybody just talks louder to them because they think they can't hear. And it's like, I can hear just fine, but we yell at them because they can't talk back, and it's got to be frustrating. And then we're going to help them with nutrition and provide family and patient education. Okay? Here's your another handout on strokes.
Are you printing those up here? Don't let them find out.
And so here's the cerebral hemorrhage. Like I said, if it's a stroke that you're bleeding, they're going to do the CT scan. And this is kind of, like it's the worst headache I've ever had because you're increasing their intracranial pressure, which gives you a bad headache, all right? So here's that, all right? That'll go in your NCLEX book. I'm glad you did what? I'm sorry. All right. All right.
It will. It helped me. No, I was just saying, I didn't know you print because they don't let us print. I can bring a printer from home. Is my name?
Any questions so far on Parkinson's, stroke? No, it's so hot we can't even think.
It's cooling down.
I'm losing blood volume from sweating. Let's take a break when you get your little handouts passed out, and that way we'll have a break and cool off. Maybe the room will get cooler. And I think, let me see what we have on here. We have Alzheimer's, and that won't take us long, and then we'll watch the movie and we'll or do a test review. All right, so let's take a break. We'll go over Alzheimer's, and we'll do a test review, and then if we have time. It's just too hard to function. Me too.
Yes.
That's why I got sick. And they got it.
And he sends me a picture of blood pressure. So this Leo. I wanted to look like a hair. This little corner. I know. You know what? What else can I do?
Yeah.
I mean,
We try. We try to help this.
I know, and I'm trying to help.
So, I had the end fixed.
You don't be flapping out.
You also, is it the Ashley?
No, that's what they told me, but
You
it's
beat up in
not.
the bathroom.
It's the one that's in the front office. That's what the HVAC. I don't know. Was that wrong? Yeah, because it was turned completely off.
Yeah,
It
because
was 85.
Super Bowl is there.
Yeah, that's what I'm saying, because that thermostat only controls that side. The thermostat that's in that front office is what controls in here. And it was turned off. It was 85 in here.
Yeah, because so many people coming out. But I had the end fix this one too. Yeah, two thermostats. One is like nothing.
Right, and the other one, and that only affects that room, because I've turned it down and it never affects this room. But when that front office is turned off, it's sweltering. No, you should if you had that, because that's what the HVAC said, is that thermostat controls this room. And it was turned completely off.
It's funny because the guy we hired from outside, he said it was the other
That's
room.
what they told us. I don't know, all I know is it was really hot, and as soon as I turned it back on, it's starting to cool down.
I'm glad to.
I'm about to sweat. Really? Do they think we don't know? I mean, that's not real. Yeah. Y'all at least get to leave in a couple weeks.
Yeah, we think they're trying to hold us hostage, so we don't know that.
No, we leaving that.
Maybe you don't know that.
I'm gonna be teaching mental health.
Non-recommended.
Oh my God.
I'll be here with you.
Maybe.
here with you.
No, y'all won't. Y'all are gonna do fine. I'm gonna go try one more time to print that off, and if I can, I'll get Miss Pitts to do it.
Just send it. Just send it. Oh, no, laugh so hard. No. Everybody's hyper. Sugar, candy bars, white chocolate.
yo, yo. What up, what up, what up? I thought you had a song to go with that. No.
No.
A little bit. Sometimes. And that view with them tinted windows, you can pull it off. Yes, I never finished most of it. No. Got the G-Wagon going. The Buick. Okay, then I can do it. Then how many shit, I can do it. Oh, let me show you this. Okay.
Is he fine? Is he a 10? No?
Please don't double tap on the feature hole.
I can't, Alexis.
Does she do that too?
She told me so I would have to tell me because I didn't know I'd always like, I had to zoom in and you can't.
So maybe I can.
Okay, I'm not gonna double tap. God.
He's in Australia.
This is, he's older than us now. He's not. There's another guy named,
Where's that video at?
I've got it right here. Hold on. Watch this.
no.
Oh, do you have this? Yeah, he does like 2 or 3. Like when she just stepped up off of that, she's like. Oh my God.
Are they saying be serious? I'm telling her, be serious.
You know what? Calm down, calm down. That's like a plant.
Who's that guy? Oh, and double tap.
You fucked around just kidding, bitch. Do it, Angela. I'm sorry.
Why is it Jonathan 77? I think
Who's
that he's
this?
trying to imply that he's older than whoever it is.
That's just Amanda.
Let that smile though. Who's her mom? I've seen her before.
You know what? I think his sister's birthday.
Who's his sister? His sister used to work with me?
No,
Oh, at the clinic. I was like, where the fuck is this sister?
she works in
What was her name? Sarai.
Isn't that so funny?
What's her
Where's Black Scrubs
name?
at? You think I can just take it and she'd be okay with me telling her that I took one? Ooh, raspberry cherry. Oh, that one. I'm gonna ask her. I'm gonna find her. Is she pull that in? Oh, I'm not asking. She's gonna pull that in.
You need to put the one that you took, you need to put it on her desk, and she won't even know.
You've done this before.
What you doing?
Oh, no, she's coming home.
What is it? It's time to get out. What you gonna do with it? Around 7:30?
Like throwback, like you were eating in your car.
Shut up. Scrubs, can I have this?
Is there another one?
No, she's out.
Use mine.
Show me another picture.
Nobody goes to work every time. Mine is trash. I just thought it was like,
That smile
you
was got
gonna bring it. You gonna bring it? Let me know.
you thinking, yeah, you fucking
Watch. No, I'm gonna do it big. Log this place. Strike. 11 seconds. Woo.
It's amazing how when I turn that thermos on, it's that cooler in here.
That's the wrong one though.
Not, alright, thermostat. Not like it should have my son here.
What? Who came in here?
Is that why you came in here?
You got baby balls.
So Marilyn, I think they came in. Pissing me off. Okay, she needs to realize she has to run in. She's in his building. Right, that's what I'm saying.
I said, you told me you was in her sweat, right? Okay, she went up there and told her, because she should have been able to tell me, but she was not there. That's another problem with this. You want to go to our resources, they're never available. Because the man there, I think, is $50. I don't know where she was at.
You know, everybody went to the Houston.
I know.
So I'm
Like
like,
this morning, I have to hunt up anybody.
He got mad at me that bit ugly. I was on that head.
you know, he always wants to come do all this extra stuff. Hey, come to the doctor. Hey, Cliff and Pete, come put these tables out, right? So since you using us to do all this extra stuff, I feel like I can use him with the AC on. So I went knock on his door. And he had his not for me. That's why I went out to show me.
Yeah,
I needed a breakdown of the budget because I didn't know if they were paying the bills or not. When you came here, talk to him. He couldn't talk to him. He was complaining about the air.
You should be complaining. I bet you under their stomach.
And
Just
they was
hot.
85. And anybody should understand that you cannot handle the heat. It is him. Because I know he's been in the heat.
Hey, listen.
Okay?
He got mad at me.
I'm just saying, he knows he can't afford to sweat.
She has no right to come off in a building full of people. She is someone in the building, but that was out of space on her part.
Like you don't know.
I mean, turn it down or up, whatever, but off, really?
Listen, I'm gonna get us a cake. I'm gonna get the me and Sean. I'll sit down. We're gonna go to the budget. Where's my money going?
And Sean gonna do it.
Is that going? Why does he act like this was at the office red carpet? He's like,
That was a take the
he's like, right in front of the desk. He's like, take her seat.
I hope they help y'all. They helped me. I sat and studied things. Just come find me when you get back. Are you coming tomorrow? All right, see ya.
Okay, everybody get their ATI stuff? Okay, presentation time. You didn't get yours? I will print it off. Guess it made 77.5 this morning. You already have a book? You can sell it, see?
It's okay. We share in the book. You could be sick every time. Come on, let's look. Okay. You're welcome. Just use it well.
I'm going to make sure y'all all get some. Okay, last thing for the day, and then we're just kind of watch our movie. Alzheimer's. Let me get it off this. I have y'all a bunch of handouts. I know you're excited. Bell's palsy and all that kind of stuff. We'll talk about that. I don't know that Alzheimer's is on here. Where is it? I need to get you something. I do. Ashley made the highest on the other group that took theirs this morning. So yay, Ashley.
Is that all you gonna say? You're not gonna. Why you gonna say the other group? We is one.
I've been down here taking the test. Anyway, okay, Alzheimer's isn't on here, but I thought it was on her.
She just like saying that level 5, girl. So where's
No, I don't.
Do you know where they get
I will
these?
get it for you after this.
Well, the person that made the lowest really need it.
Why are you gonna call me out like that?
Okay, so here's, I'm going to hand two handouts on Alzheimer's. They're coming around. There's a bunch bunch of them, okay? Y'all already had patients I know with this. The 5 days of Alzheimer's, amnesia, they first start out with, it's got 4 categories. They start out with just amnesia, a little memory loss, they might be forgetful or lose objects around the house. Then it kind of progresses. So that's all on there for you, okay? And then they have sundowner syndrome. Y'all heard of that? Yes. And this is a funny little picture. It always makes me laugh when I see it. So they start out in the morning. They're so pleasant and sweet. And then by the middle of the day, they're starting to get a little confused, maybe agitated, and you think, oh, they need to take a nap. And then by the time the sun's going down, 5 o'clock in the evening, they are very agitated, very disoriented, and very upset. So that's called sundowner syndrome, and it's going around. Yes, those are the times. That's why they always get so confused at night and pull their catheters out or try to climb over the bed. It's just bad. Bad. Okay, and then here's one, and again, this is just stuff for y'all to have, as a resource. Dementia. And it tells you the things that you want to check for before you just say, well, they're just crazy old person. You don't want to ever say that.
You should look for a handout that tells you like all of the
all the term
readings.
This one says like you want to check, make sure they're not like their drugs or prescription drugs are toxic for them, or they're on some kind of alcohol. Check their eyes and ears. Make sure they don't have any kind of metabolic or endocrine issues. Because remember, we said if their pH is out of whack, doesn't that cause a neuro change?
Yeah.
So emotional disorders, neuro disorders, tumors, trauma, infection, and then the atherosclerosis, making it hard for the blood to flow to the brain. That could also cause dementia symptoms, okay? So that's going around. Look at this. Oh.
You said I missed them there every single one.
All right.
I just need a little. I need a cheap farm book like this. Does this have farm?
And then the last one I'm passing around just says warning signs after a head injury. This doesn't actually go with our topic today, but since we're on neuro, I thought I'd throw that one in case you need it for the influx, okay? Changes in level of consciousness, a sudden onset of seizures. That could be, a head injury, or there's something else going on neuro-wise. All the neuro symptoms are very similar because it's, it's neuro. So have that, study that. Okay, last topic we're going to cover today is Alzheimer's, and that's what the movie is actually about. So this is just all we have to do, y'all.
Can I ask a question real quick?
Yes.
Was that the movie with the lady husband?
This has a red-headed lady in it. Have you seen that
The
one?
other one, she just be her. Does she leave him? That's about 5 minutes.
She got pregnant, so who didn't get their ATI? So the last 2.
I mean, I don't need it because I can print it home.
No, I can print it. I just don't know why it's taking it to today. But I'll get one. She didn't get it.
So we gonna
Did
do
you get the account code so that you
Okay.
can like order ink online? From the business?
Okay, there is no slide for this one, so I'm just going to give you the notes verbally. Chronic progressive degenerative disorder, that's Alzheimer's. It's in your book, though. It affects the cells of the brain and causes impaired intellectual functioning. I'm sure you've all had those little patients, or you know somebody that has it. They're very sweet, like I said, in the morning, and then by the afternoon, they're kind of getting irritable. And by night, they're turning into little, meanies. They want to pinch you, or if they're not cooperative, and they don't want to tell them what to do. Their whole personality changes. And it's not something that's their personality, that's just their neuro. It's affecting them, okay? Common causes of dementia in older adults. There's just lots of different things. Age, diet, the way our genetics are, the way they have a lot of plaque going up to their brain. It's more common, Alzheimer's is, in men than women, but certainly I've seen a lot of women patients with it. Starts in the late 40s, early 50s, and the cause is unknown, like I said, that they can define, but they know there's a lot of things that people have in common that have this, and genetics is one of them. plaque going up, through the carotids to the brain. That can cause it. They think that's slow blood flow. They might have a tangled mass of neurons in there. Just lots of different theories. The neurons are the neurological cells in the brain. Those are just dying, and that causes the brain to actually shrink. And there's a neat picture in your book where it shows a part of a brain that has Alzheimer's and one that doesn't. And you can see there's an obvious change in the size of the person that has it and doesn't. And they've also found that people with Alzheimer's, they have large deposits of aluminum in their brain post-mortem. After they die, they do an autopsy, and there's large deposits of aluminum. Do you know? That's what she says. Do you know where we get aluminum from? Deodorant. And I just looked at mine yesterday, and I was like, oh Lord, aluminum is one of the components of it. And yeah, that's what I see.
No, we can't afford it not to wear. Not going in here?
Anyway, that is a big deal. I mean, that's why they've seen a sudden rise in it, because they started using deodorant with that aluminum. Also, aluminum cans. If you drink from aluminum can constantly, you're drinking.
The government is trying to kill us.
Yeah, it's a big thing. So look for aluminum-free deodorant and drink out of bottles, which you get something else from that, I'm sure. But anyway, just drink water. Anybody know some of the things you can do to prevent it?
Lemons.
No. Prevent Alzheimer's.
Oh, yeah.
You talking about BO?
Yeah.
That's what I was talking about too. I was like,
Are you okay?
if you get a deodorant without aluminum, use one instead.
My grandma's trying to get everybody to wear
Why would you
baby soda.
I mean, it's a horse.
I'm coming here with that. No, yeah.
It's already muggy in here. Please, everybody, wear your deodorant.
I wear too many black clothes.
Finish your answer.
It is for things that you can do. I'm getting to it. To help is reading. They say people that read. His name is Cliff.
Cliff and he's together.
You got plays for everything. They're hilarious. It's the heat, Cliff. Damn, Cliff.
It's time to go home.
So they said reading, doing crossword puzzles. That's why you see a lot of little elderly with crosswords in their rooms. It's supposed to help keep that brain sharp. So if you have it in your family, like I do, go ahead and start doing crossword puzzles every day. Reading a lot, learning new languages. That's supposed to help delay Alzheimer's. Okay? Yeah, because it makes your
So
brain
if
think.
we have it in our family, we're gonna get it.
More than likely. Unless you do a lot of the things to prevent it, like they said, exercising your body and your brain, keeping it sharp. You notice a lot of people, and I've started noticing this the older I get, when they retire, they just kind of deteriorate. They don't have to think and use their brain every day when they retire, and it's like they start really slipping real fast.
Like,
So-
she's a nursing home administrator, and she's seen so many people that just retired a couple years ago, and now
their brain just
And so
drops.
she-
Yeah, because you're not having to use it. So they lose it. Some of the foods, antioxidants. Have y'all seen a bunch of stuff here lately on the news and all this? They're really pushing antioxidants, vitamins and stuff, foods with antioxidants. That's supposed to help. So citrus fruits, dark green leafy vegetables. If you ever see that on the enclaves, just pick it because one of those tomatoes, brown rice, things like that. They're healthy. And then beta carotene, stuff like sweet potatoes and carrots. That beta carotene is supposed to keep your brain sharp. Okay. Yeah, it's all in the book. Antioxidant foods. So just remember, there's 4 stages of Alzheimer's. It starts out just mild memory lapses where they can't really think of the words or misplaced objects. And then I know it's stress that makes you do that. And then stage 2, it starts to get more obvious where they have short-term memory. They might get disoriented, like the little old lady did in the commercial. Where did I park my car? Those things I do too. But because it's me in 20 years. And then disorientation is the 3rd level where they're really disoriented. That they don't know who their own family members are. And then the last stage is terminal. They're where they're aphasia, they're not speaking, they're just kind of sleeping all day and night. Severe mental and physical deterioration, okay? So just read over Alzheimer's and we'll, like I said, that's not, none of the stuff we went over today will be on tomorrow's test, but it will be for next week, so I'll give you time to read over it.
Read over.
Wear me out. You have it graded today?
What kind of medicine do you need, Joe?
Wow, I really need my blood pressure
I mean, it escalated before that. I was trying to leave those on my stuff is in the corner. I was like, She's like, where are you going? I didn't know you said it, and I was like,
Keith, you got some stuff with you?
why is that your business?
Can you check my blood pressure?
Well, it started off. She said, you don't know. I said, this is my dad's house. You don't even know here.
Go see. Give her a lip smack.
I feel like it was getting
Oh, I'm sure she is. This is the end. To say the least. She's heading.
I was a junior in high school.
She's told she's sitting here with us.
No, this can't go that shit though.
put her skinny ass in
She does. Once we get Chelsea's blood pressure under control, I think we'll do a test of you if y'all want to. And then we'll just like.
I got these cards. What did my mom's house told her what happened?
What'd you say? We'll do what?
Test of you and then just do the blood pressure. She had made a test, but I don't know. Hit her card. There's no way I'm gonna do that. That's really not. That's just more work for me because I have to grade it.
She's hilarious. She said when you're done with your life story.
Well, that's funny. She said she didn't like the stepmom, so she did a card. And then,
I get people cards. Why is it still hot?
Because Pepper would have turned it back up. How much she did? It was the lady Gus, and that didn't work, so then she don't.
I bet she's got it on 85 right now.
Are you supposed to lady Gus this?
Yes.
Yeah, that's
Yeah,
not
it was still growing.
Okay, but he said that doesn't control our
No, but he is wrong.
Yeah,
Because the HVAC people in Reddit told me the same thing, that she's got it. That's why it's hot in here, because her thermostat was turned off. And I've been freezing this little man to death in here. The big. What's his name? I can't even LRC. RC man.
little, what?
He, I'd go in there and turn it down to 60 because it was hot in here, and it would blow in his room and still be hot in
He's
there.
like
And he said, no, I'm freezing to death.
Oh, so whenever you control that one, that just controls his
His
room.
room and Gus's office.
So you were punishing him.
Right.
So it really is her. Conley, whatever her name is.
Her name is Chester.
Tell her quit emailing me.
All right, so we have a test in the morning, all right?
Yes, ma'am.
It's only going to be on the stuff that we did before today, okay? So I'm going to ask you to be quick. This is pretty much straight off the test. It's the same thing that we did the other day, but if you want to record it again, you can.
So it's just like your recording.
Chelsea.
Ones you were talking about, asking me about. Okay, and you know what? Back in my trip. That's fine.
Infill day with my husband up there. Infill day.
So what do you think? If you just, if you know, you just have to
He said my boyfriend should have one thing over there.
where the heart is, to give me one part for the conversation on that on this
Alrighty, y'all ready?
I love it.
Can you hold my phone?
Make sure you got it going this time. Let's go.
Alright, so if I have a patient who is incontinent, she's real upset about it, what is the first thing I want to help her do emotionally? What do I want to support her? Calm down, be supportive. When I say something like, I know you're upset, acknowledge that it is upsetting to her. I know you're upset and discouraged right now, but we're going to give you help, and you allow them to voice their feelings, their concerns. Okay? So be supportive. What is peridium for?
Singing and burning.
It's an LD that takes away the stinging and the burning of a what? Yeah. Okay. Is it an antibiotic?
No.
It just takes away. And what does it do to your urine? Is that something you want to teach your patient?
Yes.
So that'll work out. Okay. Our catheters. Clean technique or sterile techniques? Sterile. Always sterile. What? We're going to put them in a recumbent position, which is on their back, right? And if it is somebody that you can't visualize it, and you feel like it's going to be difficult to keep your sterile technique, you get help. Okay? If we accidentally insert that catheter in the wrong spot, do we continue? We'll start over. Okay. What is the catheter I use for somebody who has an enlarged prostate? Coude. It goes around that prostate. Coude. Ashley can spell it for you. She knows it.
C-O-U-D-E.
There you go. So, when I have a person that has decreased kidney functions, what's the lab work that I'm going to be looking at? Urine and creatinine. That always, is what they look at that indicates whether the kidneys are filtering out stuff or not. If my BUN and creatinine are high, what does that mean? My kidneys, are they working or not working? They're not working. That should not be high like that. What color should urine be?
Yellow.
Clear to light yellow. If it's too cloudy, that means infection. If it's too dark, yellow, maybe dehydrated. Bright orange, like Ashley's is for their peridium. And then cola or smoky colored, blood. Blood.
Oh,
The oliguric phase of renal failure, is their urine output going to be high or low during that time? Low. You're going to have low urine output. What would be a normal range for that? 100 to 500 per day. Per day.
That's what we want, right?
No, that's if they're in oliguric phase of renal failure.
Per day.
100 to 500 per day is what you're going to see if they're in the oliguric phase.
But it's 30 mLs per hour.
Yeah, on somebody that's the minimum. That's minimum. If they're under 30, then they're starting to have issues. 100 to 500 per day is the urine output for oliguric phase where it's low. That's not a lot. Okay, number one nursing intervention for renal patients is something we're always going to be checking our nose. What if they're a dialysis patient? Checking weights. Just once? Before and after. What kind of diet does a person that's having trouble with their kidneys need to be on? Sodium restricted, low sodium diet. What if they...
She already wrote it out down.
She better make 100.
Let me see what you wrote down.
Low sodium diet if they have kidney issues. Because remember, we don't want them to retain any more water. Sodium makes them hold on to water. So they should be on a low sodium diet. What if they really want their salt and they're throwing a fit and they need salt? What do you give them as a
Lemon
substitute?
juice.
Lemon juice. If I'm still really thirsty, I need some water. Or candy. Can I have ice chips? No. I'll tell the doctor to tell you. You're are fluid restrictions. I mean, you
You
want to
eat
get
hard
water.
candy, right?
So
Right.
why isn't this stuff on camera?
So that's AO's
Yeah, it's not a fluid. The ice is considered
But
fluid.
if your mom is telling you
But you're
to
not
That's already in your body though. Yeah, you're not putting more in. And it's mainly just to keep your mouth, the taste, and a little bit of moisture. Okay, so dialysis, there's the machine dialysis, that's where they take their blood out, and then there's the peritoneal one, where they put the catheter in and out, like I showed you on, and we talked about in the book. What is the major complication of abdominal dialysis and peritonitis? Always check your weights before and after. Let's see. What if they have a temp when they're doing their peritoneal?
It's a sign of infection.
Yeah, we need to report that, don't we? Now, if I've had the urge to void, I really need to go void, but I can't get it out. What would that indicate?
Prostate.
Which is what? But what kind of blockage or obstruction? That's obstruction. When I feel like I need to go, but I can't, it can be stones, it can be the prostate, or some kind of mass that's obstructing my urine flow. Okay. Let's say they go in for a cystoscope, where they take the catheter with the camera on it to check out the bladder. And after it's all done, the patient's telling you that it's burning and hurting when they void.
That's expected.
Yes, you tell them, I know that's upsetting and painful, but that is part of it. It's expected. And, it's going to be inflamed and irritated for a little bit. What do we do for a patient with kidney stones? Good. Increase their fluids because we want to flush it out. Destroying their urine because we want to catch it. And then give them some kind of pain meds and antibiotics to help too. Okay. Bladder spasms are real painful. If I've just put a catheter in, where do I cut it off to prevent bladder spasms? Yeah, no more than 1,000, 800 to 1,000. What's the medicine I can give them to help stop bladder spasms? BNO suppository. Belladonna.
You said that, what about the last one? Cutting it.
Okay, from the catheter, if you insert the catheter and they're having a lot of excessive urine output, at 800 to 1,000, no more than 1,000 cc's output on that initial, putting in the catheter for the first time, you want to clamp your catheter. Because if you go past 1,000 cc's all at once, the bladder is going to start spasming. It's just like a big water balloon, and you just let all the water out of it too fast, and it's still stretching, and so all those nerves and they just start twitching and spasming. It's painful. So you can give them a B&O suppository, a belladonna and opium suppository to help that. There is a question about Glasgow Coma Scale on there, so make sure that you understand that what you're doing is asking them those 3 categories, and then you're going to grade them. You're going to give them points depending on what they answer. All right? 3, not doing real good. I think it's 8 or less is considered a coma, but above 8 to 15 is they're responsive. Okay? And we kind of talked about this earlier. EEG, that's the thing they put on the electrode test to check their brain activity. Need to stay awake, or do I go to sleep all night tonight? Need to stay awake. Wash their hair that morning. And it takes all day, so don't expect to be there 5 minutes and leave. But when it's done, it's done. They don't have any kind of restrictions. Do they have to be MPO for that? No. But can they take medicines? No. Because we don't want them to have anything that's going to alter their brain activity. No sedatives. Okay. Seizure protocol, like I said, they're going to lay down. You're watching for safety and aspiration risk. We time it. And we watch their respirations while they're in the post-ictal phase. Watch their respirations during the post-ictal phase. Everybody understand that?
Yes.
You're not going to reorient them during that time because they're still asleep. They're still unconscious. We're going to monitor the respirations. That's why we're monitoring those, because they're unconscious. We want to make sure they continue to breathe on their own. Because if they stop breathing, then what do we have to do? CPR. CPR. Alright, this is ready. What is it called when they have, right before they have a seizure or a headache? Aura. And we want to make sure if they come and grab you. And this actually happened to my, supposedly, they told me this, but I think I did believe them. They were at United or Market Street, whatever this one is right up here, yesterday, and I came in 15 minutes late, and I was like, why are y'all late? It was level 1, and they said they were getting their food, and this lady walked up to them because they all had on their scrubs, and she said, I'm fixing to have a seizure, and she grabbed onto me, and she really had a seizure. So I think she had her aura, and she knew when she saw they were in scrubs and thought they could help, I guess, and so she had it. No, they gave me the manager's name, and so, but anyway, she did, she had a seizure, and the ambulance came and everything, but she had a really good one, so we had just talked about it, and they needed to turn on her side and time it, and
I bet they felt real special.
they did, they were lifesavers that day.
I had to feel special. I would have said.
Yeah. That's the story they gave me. Well, we had just talked about it, and that's why they were so proud.
I'm happy you was your level 1 because our level 1 wouldn't have worked.
Y'all would have walked right past?
I wouldn't have walked past, but
Should have been checking the
somebody needs to come up here.
But you would do that. Tell me some triggers of that could cause a seizure. Like alcohol, excessive fatigue.
My stomach is hurting me.
Okay, I'm sorry. Almost done. Bladder infections, it's on there. Bladder infections, just think, make sure that it might say flank pain, even though we know the bladder's down here. Sometimes it'll radiate to the flank where the kidneys are, so they'll have flank pain, strong smelling urine, burning, and urinary frequency. These are good select all that apply questions right here, okay? If they have bacterial, we want to make sure they don't have any bacterial growth in their urine, so we're going to tell them what to drink what? Water and cranberry juice, high acid, stuff like that. Can freeze fluids and urinate after intercourse, just like on our little handout we got. If somebody has acute glomerulonephritis, I just give up on that word. They're going to have facial puffiness. These are select all that apply kind of questions. They're going to have facial puffiness because they're swollen, right? They've got something in their kidney that's making it not work, so they're going to have extra swelling. Peripheral edema, loss of appetite. They're not going to want to eat because they're sick. They don't feel good. And then they're going to get up a lot at night to pee. So that's 1, 2, 4 things. They're going to get up a lot at night to pee. They're going to have a loss of appetite, facial puffiness, and peripheral edema if they have that acute glomerulonephritis. Kidney stones, do we want to get on a catheter? Never. We're going to strain their urine and increase their fluids like y'all said earlier. Okay? And being active. Walking around might help, make it move. Okay, bladder cancer, if they have a high risk of that, they're cigarette smokers, or they've already had prostate cancer. That could lead to bladder cancer. And the last one, cluster headaches. Yeah, that's the one that's pretty predictable. Nasal congestion, same time every day, altered sleep weight. Remember, a migraine is the one that's on unilateral, but clusters are the ones that are kind of predictable. Okay? Any questions? I think y'all will do really well.
Me too.
It's only 40 questions, right?
I think it's 40, and then there's some matching at the end.
Yeah, let's go with that matching.
That's so suggested at the very beginning of class.
I'll take a break if you need to, a long break. Okay? We're going to watch our movie when we get back.